on January 14th, I guess it was, that there was no human-to-human transmission. Well, there was. They probably made that statement in the second or third week of December in addition, but they made it very powerfully on January 14th. And they criticized me very strongly when I said that we're going to shut down flights coming in from China, and especially from certain parts of China, but from China generally. We were criticized very badly. So last year, and for many years, hundreds of millions of dollars has been paid to the World Health Organization, hundreds of millions of dollars a year. And last year was $452 million, and China paid $42 million. Before that, it was $500 million, and China paid less than $40 million. And before that, it was similar numbers in the 400s, 300s, and sometimes even in the 500s of millions of dollars. And China would do proportionally just a small fraction of that number. And I think they have to get their priorities right. And their priorities are that everybody has to be treated properly, every country. And it doesn't seem that way, does it? It doesn't seem that way. So we're going to do study, investigation, and we're going to make a determination as to what we're doing. In the meantime, we're holding back. We want to say very unfair. So the United States, $452 million compared to $42 million. That's to the World Health Organization. That's not good. That's not good. Not fair. Not fair at all. And other countries, as you know, also gave very substantially less than the United States. And the World WHO, World Health, got it wrong. I mean, they got it very wrong. In many ways, they were wrong. They also minimized the threat very strongly, and not good. I want to take this opportunity to express the thanks of an extremely grateful nation to the Americans who go to work every day, especially in these critical industries in the midst of the pandemic, to care for and protect and feed American people, including medical personnel, law enforcement, first responders, food suppliers, sanitation workers. And somebody mentioned today, would you please specifically call out cashiers and clerks at grocery stores who are in danger during the pandemic, during the epidemic. They're in danger. They're really in great danger. And they've been incredible, and I want to call them out, to cashiers and clerks. We grew up with cashiers and clerks and grocery stores, and they've been great, and they've really been true American heroes. So I want to call them out because they're working hard, and they're working in conditions that aren't ideal, but soon they'll be ideal again. As we mourn the terrible loss of life for this and from this grave pandemic, we're seeing signs that our aggressive strategy to slow the spread is working. The number of new cases is stabilizing. The number of beds necessary in so many locations. I was watching this morning New York. I was watching Louisiana. You see what's going on. The numbers are changing, and they're changing rapidly, and soon we'll be over that curve. We'll be over that top, and we'll be headed in the right direction. I feel strongly about that. Some terrible days ahead, but we're going to have some wonderful days ahead. And we're going to get this behind us, this terrible thing behind us. Some people will never be able to forget if they had a loved one, if they had a great friend or a friend. But we're going to get it behind us. This is a tribute to the discipline and the devotion of the American people, what we've accomplished. If every American continues to strictly adhere to social distancing guidelines, we can defeat the invisible enemy and save countless lives, so we can do it much more quickly. We're hopefully heading toward a final stretch, the light at the end of the tunnel, as I was saying. As we continue to wage all-out medical war to defeat the virus, we're also fighting an economic war to ensure we can quickly turn to full financial strength. We have to get our country back. We have to get going. Everybody wants to get going. Yesterday, I asked Congress to provide an additional $250 billion to expand the incredibly successful Paycheck Protection Program. You've seen what's gone on there. It's incredible, actually. which is allowing our small businesses to keep employees on the payroll and get ready for the opening. Like a second opening to protect millions of American jobs. I'm asking Congress to pass additional funding for this program this week as soon as possible. And I think we have pretty good understanding with the Democrats. Hopefully it's going to be bipartisan. We do not have time for the partisan games, and we don't want that, the obstruction or totally unrelated agendas. We want to do this for the small businesses and the workers. And we can do a phase 4, and a phase 4 will be later. This will be an expansion of what we've already done because it's so successful. The $350 billion will be expanded by hopefully $250. And if you look at the kind of loans, thousands, tens of thousands of loans to small businesses, it's a great thing to see. It's turned out to be more successful and more productive than anybody would have thought. But Democrats and Republicans are coming together to get that job done. That's a very important job. In recent days and days ahead, we'll restore America's health and economic might, but also dimensions of our national strength will be brought together, I think we have a chance to be stronger than ever before. We've learned a lot. And we have tremendous stimulus now, tremendous stimulus. And we're going for more. Hopefully we'll be doing an infrastructure bill so we can rebuild our roads and highways and bridges and tunnels and all of the things that we should be doing for our country. We're going to rebuild our country, not other countries where they don't even appreciate it. As our citizens persevere through this present challenge, we're renewing American unity, and we're replenishing American will, and we are witnessing new American valor each and every day. We see it every day. The daring and determination of our people in this crisis reminds us that no matter how hard it gets, no matter what obstacles we must overcome, Americans will keep on fighting to victory, and we will secure the glorious future that our citizens so richly deserve, especially after going through this nightmare, this evil beast. So we're getting very close, and hopefully it will. Hopefully it's on the other side, and it will end soon. And I think it will. And I just think that the people of this country are fantastic. So we'll take a few questions, and then Vice President will take over. Please, go ahead, please.
Thank you so much, Mr. President. ABC is reporting that your intelligence committee was warning about the virus as early as November and produced a detailed report about the outbreak in China. When did you first learn about the intelligence, and could you have acted on it then?
Well, I learned when I learned about the gravity of it was sometime just prior to closing the country to China. And when we closed up the flights coming in from China and various other elements, and then, as you know, we closed up to Europe. So I don't know exactly, but I'd like to see the information. Yeah, please, please.
President, a lot of Americans want to see businesses reopen,
yeah,
get back to
so do
work.
I, more than anybody.
So what specifically has to happen for you to feel that it is safe to reopen the country, and what is your plan to do that?
Well, I think we can say that we have to be on that downside of that slope and heading to a very strong direction that this thing is gone. Now, we could do it in phases. We can go to some areas, which you know, some areas are much less affected than others. But it would be nice to be able to open with a big bang and open up our country, or certainly most of our country, and I think we're going to do that soon. You look at what's happening. I would say we're ahead of schedule. Now, you hate to say it too loudly because all of a sudden things don't happen. But I think we will be sooner rather than later. But we'll be sitting down with the professionals. We'll be sitting down with many different people and making a determination. And those meetings will start taking place fairly soon.
So you wouldn't do that until the health experts tell you it's safe to do it?
Yeah, I would rely very heavily on them, yeah.
Do you think, is there a system for monitoring and testing that you're looking at?
Yeah, we're putting in very heavy testing systems. We have the best testing systems. And again, don't forget, when we look at cases, I'm looking at I'm not going to insult anybody, I'm not going to insult any country, but I'm looking at countries that are showing less cases than us. That's testing. We're testing more than anybody. And you saw exponentially more than anybody by far. And our testing's become, I think it'll end up being a big strength. In fact, the other countries that the media talked about are now calling us for what are we doing and how are we doing it so quickly. And where are we getting these tests? Because our tests are really good now. They've been proven to be very accurate. Yes, please.
Thank you, President Trump. Two quick questions.
Yeah, sure.
One on infrastructure. Members of your administration and members of Congress have pointed out that the top paid federal employee, it's not the president, it's the head of the Tennessee Valley Authority, and he made $8 million last year. And
It's ridiculous. I agree. It's ridiculous. I think it's the highest paid government. Long before I got here, you said Tennessee Valley Authority, right? Has to be the highest paid man in any government. Makes approximately $8 or $9 million. I don't know the gentleman, but he's got a heck of a job. He gets paid a lot of money. He's been there for a long while, hasn't he?
This one actually is new. It came in April, but the previous
Well,
one
that's a
was-
separate. Yeah, that's separate. But I'm talking about the. We just have some new people going on the board, I know. But as you know, that's a quasi-public agency, and whoever the head of the agency is, that person makes a lot of money.
If I could ask my second question.
Which is an amazing thing, right? And when we want them to do something, they're not there for us. That's not good. That's not good.
The second
They've been there
question-
for a long time. That's been a story for a long time.
And I assume that you would support reducing that salary as part of the infrastructure bill.
Yeah, reducing it by a lot.
Thank you. And, my other question
That'd be
is,
the greatest job in the history of government, almost. Certainly, if you're into money. Tennessee Valley Authority. That's right. Go ahead.
so
I've been waiting for somebody to ask me about that. It's been bothering me for a long time too. Go ahead.
One of the biggest rating hits of the coronavirus, aside from these briefings, has been a show on Netflix called Tiger King.
Yeah.
And the man who's the star of this is a former zoo owner who's serving a 22-year prison sentence. He's asking you for a pardon, saying he was unfairly convicted. Your son yesterday jokingly said that he was going to advocate for it, and I was wondering if you've seen the show and if you have any thoughts on pardoning Joe Exotic.
Which son? It must be Don. I had a feeling it was Don. Is that what he said? I don't know. I know nothing about it. He has 22 years for what? What did he do?
He allegedly hired someone to murder an animal rights activist, but he said that he didn't do that, and he was.
Do you think he didn't do it? Are you on his side?
Well, I'm a reporter.
Are you recommending a pardon?
No, I'm not advocating anything.
As a reporter, you're not allowed to do that. You'd be criticized by these. Would you recommend a pardon?
I'm not weighing in on Tiger
I
King.
don't think you would. I don't think you would. Go ahead. You have a question? I'll take a look. Is that Joe Exotic? That's Joe Exotic.
Let me get back to
Go ahead.
the coronavirus if I can, Mr. President.
Yeah.
Last week, your top experts were saying that we should expect 100,000 to 240,000 deaths in this country. You've been talking about how it looks like maybe things are plateauing. Are these numbers now being revised downward? I know you don't want people to stop social distancing and that sort of thing, but what can you tell us about the numbers? Are they being revised?
My impression, Jim, is those were the numbers that were set, and they were set as an expectation from quite a while ago. I think we're just doing much better than those numbers. If either of you would like to talk about that, it's a fair question. You want to come up, Deborah?
I know Dr. Redfield said something about it too.
Yeah, so I think all of you, many of you have done the analysis of the same models that we utilized. And if you do the models of the models, you end up with that range. At the same time, we've carefully looked at Italy and Spain, and we are doing much better in many cases than several other countries. And we're trying to understand that. We believe that our healthcare delivery system in the United States is quite extraordinary. I know many of you are watching the Act Now model and the IHME model and they have consistently decreased the mortality from over almost 90,000 or 86,000 down to 81,000 and now down to 61,000. That is modeled on what America is doing. That's what's happening. And I think what has been so remarkable, I think, to those of us who have been in the science fields for so long is how important behavioral change is, and how amazing Americans are in adapting to and following through on these behavioral changes. And that's what's changing the rate of new cases, and that's what will change the mortality going forward, because now we're into the time period of full mitigation that should be reflected within the coming weeks of decreasing mortality. I mean, that's what we really hope to see. We are impressed by the American people. And I think models are models. I've always worked on validating I spent my life validating models all over the world, and that's why we do surveys and surveillance, and we make sure that what we think is right is right. I think this will change how people look at respiratory diseases, because it will change what is possible when the globe, and particularly the American people, do this level of mitigation. And I think, as I talked about yesterday, we are still in awe, really, of the American people's strength in this and following through.
If I could just ask Mr. President.
Yeah, I'm going to do that. I'm going to ask Bob to come up just for a second. Director, I think that's it. We've done, they have done, everybody has done, everybody a great job. So those were original projections, and we don't want to say anything about beating it yet, but I think we will have a very good chance to beat them very substantially. Bob, please.
Thank you, Mr. President. I just want to add to what Ambassador Birx said. I mean, this is a consequence of the commitment of the American people. You know, a lot of us have always had challenges changing behavior, whether if it's exercising regularly or different habits with smoking, when it affects us. What's been remarkable to watch here is how the American public has changed their behavior when it protects the vulnerable. I think that's really what I'm so proud to see.
Mr. President, just a follow-up on something from yesterday and a quick just yes or no question. Yesterday you said you had not seen Peter Navarro's memo on the coronavirus back in January, February 23rd. Were you ever briefed on those memos? Did you ever discuss those memos with anybody?
I don't remember that. I've now seen the memo. I saw it. It was, Peter sends a lot of memos. I didn't see the memo. As you know, World Health was saying that was not correct because at the time they called it wrong. But I didn't see the memo, but I acted as quickly as people were shocked that I acted so quickly, and everybody thought I was wrong because I did act so quickly, as you know, with respect to closing the borders, with respect not only to China, but with Europe, I closed the borders, and I think that was very important. But no, I didn't see the memo at the time, but I have seen it since. Yeah, please.
One other quick
Wait a minute,
question.
Jim, let me do a couple of others. We'll go back.
The head of the World Health Organization today warned against politicizing.
I agree with that.
And he said that consequence of this politicization could actually create more body bags. It's a pretty vivid image. I mean, what do you believe the consequences of the U.S. pulling out its funding of the WHO?
Well, I think when you say more body bags, I think we would have done, and he would have been much better serving the people that he's supposed to serve if they gave a correct analysis. I mean, everything was, I said, China-centric. Everything was going to be fine, no human to human, keep the borders open. He wanted me to keep the borders open. I closed the borders despite him, and that was a hard decision to make at the time. We were all together. We made a decision against the World Health Organization. So when he says politicizing, he's politicizing. That shouldn't be. But look, we spend $450 billion, $452 billion, almost $500 billion last year, hundreds of billions in previous years. And they got to do better than that. They got to do better. When you talk about politics, I can't believe he's talking about politics when look at the relationship they have to China. So China spends $42 million, we spend $450 million, and everything seems to be China's way. That's not right. It's not fair to us, and honestly, it's not fair to the world. Okay, question in the back? Yeah.
Thank you, Mr. President. There's breaking news today and a couple of reports from a couple different outlets that Jared Kushner's team is seeking to create a national coronavirus database, a tracking system for patients who've been diagnosed. Now, his spokesperson said that that's not true.
Yeah, it's not. I have never heard about it. Doesn't sound like a bad idea, actually, but I have not heard about that.
Be okay with it if it.
I don't know if I'd be okay. I have to see it, but it sounds very scientific, and it sounds like it could be good based on tracking, but it also has to do with rights and lots of different constitutional questions. I have not heard that at all.
Okay, so some people are concerned it would be like the post 9/11 Patriot Act, that it ultimately led to the FISA abuse. Are there any? Are you concerned
FISA
about
abuse,
that?
of which I was the one abused, and a couple of other people, in all fairness. No, I don't know anything about it. I haven't heard it. I mean, I'll speak to them. I don't think so. They would have told me. I would have known about it. Please.
Thank you, Mr. President. The Nevada delegation is unhappy because smaller casinos and businesses that make profit from gaming in Nevada found out they're not eligible for the CARES Act PPP money. Is this, and I talked to one member who said
You
gaming,
mean because of the number of employees?
because of the number of employees,
And yet they're small businesses.
and they thought gaming would not be treated any differently than any other business with this. Was this
Well,
an
I could look at
oversight?
that. I could look. It's a great state, and I will take a look at that strongly. Are you talking only the smaller casinos? Yeah, I'll take a look at that. Fine. I don't mind that. Please. Yeah, we'll take a look. Yeah, we haven't heard. Nobody's told me about it, but I'll look at it. It's a great state. They do a great job, so I'm going to look at it very strongly. I understand what they mean. Please.
Thank you, Mr. President. Turning to the economy, what if you urge Americans to go back to work and they don't listen to you? Would you leave that up to the governors, to businesses, to citizens to decide when it's safe to stop social distancing?
Well, when you say they don't listen, I think they're going to listen. They want to go back. Everybody wants. They're going stir crazy. They've been in those houses and those apartments, and they're built. I mean, they've really been. They've done a great job. Again, when you look, the question was just asked about, about how are we doing compared to projections. Those were just original projections. The big projection being 2.2 million people would die if we did nothing. That was another decision we made. Close it up. That was a big decision that we made. Two very smart people walked into my office and they said, listen, these are your alternatives. And that was a projection of, I guess, 1.5 to 2.2 million people would die if we didn't close it up. That's a lot of people. So if we do a number that's tremendously smaller than that, now if we did close it up, the numbers got to 100 to 220 million people. So if we can stay substantially under the 100, which was the original projection, I think we all did a very good job, even though it's a lot of people. Say it?
You think we'll be on track for that by May 1st?
Well, right now, we're doing well in terms of the numbers. I can't tell you in terms of the date. We don't want to go down, and then we can start going up if we're not careful. So we have to be careful. As far as distancing, social distancing, and other things, certainly for a while, at some point that's going away. We'll be able to sit next to each other and everything like we have all our lives. This is a very unique thing. This has not happened, anything like this of this magnitude, since 1917, 1918. The great pandemic. That was something. But people want to sit next to each other at restaurants. They want to sit next to each other like normal at a football game, baseball game, basketball game, hockey game. No, we want to go back to life. Now, the first period of time, maybe we'll go a little bit slower, and maybe we'll be talking about distancing. But at some point, we expect to be back like it was before. And hopefully, it'll never happen. Hopefully, it will. If it does happen, it's going to be in 100 years from now. The last one, 1917. That's something. It's a long time ago, and that was a horrible thing. Jim, go ahead.
Yeah, I wanted to get back to something you were saying yesterday about people going to Wisconsin and voting in the middle of this pandemic, really putting their lives on the line. And you said, well, if they do that, vote by mail, perhaps we'll have voter fraud in this country. I just wanted to ask you, voters in 5 states, Utah, Colorado, Hawaii, Washington, and Oregon, all vote by mail. Can you or the White House staff or your campaign provide any evidence to back up your claim that mail-in voting is rife with fraud, like the example you gave of people working in rooms filling out false ballots? Sure. You've been talking about voter fraud since the beginning of this administration.
Very fair.
And where's the evidence of it?
I think there's a lot of evidence, but we'll provide you with some, okay? And there's evidence that's being compiled, just like it's being compiled in the state of California, where they settled with Judicial Watch, saying that 1 million people should not have been voting. And you saw that? Did you, wait, excuse me. Well, I'm just telling you. I'm telling you, in California, in the great state of California, they settled, and we could have gone a lot further. Judicial Watch settled where they agreed that 1 million people should not have voted, where they were 115 years old and lots of things, and people were voting in their place. What I see, and every one of those states that you mentioned is a state that happens to be won by the Democrats. And if you have a position like me, where it's registered. You're here, and we're voting someplace where I'm not. I haven't left the White House in, I guess, months, other than to, ask a ship to, wave it goodbye to New York, which, by the way, is now going, as you know, being used for the purpose that we're talking about, which a lot of people wanted. Wait a minute.
Voting doesn't work out well for the Republicans.
Well,
so
it hasn't.
Isn't your concern
It
really
certainly
just political?
hasn't. But if you're a senior citizen and if you're somebody that needs it, I'm all for it. But they have to be very careful, because you know the things with bundling and all of the things that are happening with votes by mail, where thousands of votes are gathered. And I'm not going to say which party does it, but thousands of votes are gathered and they come in and they're dumped in a location, and then all of a sudden you lose elections that you think you're going to win. I won't stand for it. Well, we're going to find out about the proof, because you're going to see what's going on. And I'm not going to stand for it. Our voting system, first of all, we should have voter ID. When you vote, you should have voter ID. And if you send something in, you should be sure, as a state and as a country, you should be sure that that vote is meaningful and it's not just made fraudulently, because there's a lot of fraudulent voting going on in this country. This country should have voter ID. Okay, let's do another one. Go, please.
Mr. President,
Thank you,
currently the only way that we can track these millions of doses of hydroxychloroquine that are being distributed across the country is through the e-health data system. How systematically is your task force watching the system?
Well, I think it's very systematic, yeah. We're distributing the hydroxy all through the country. It's being distributed in large amounts. We have it coming in now. We were up to 29 million doses, then we went to 30 million doses. But we have it coming in all throughout the country, and much of it's being distributed. In fact, it'll start going down what we have in our stockpile. And again, it's had, I hope it works. Again, I'm not a doctor, as you possibly have found out. I'm not a doctor, but I'm a person with common sense. And we've had some very good results over the course, including a woman who just reported it 2 days ago. Yes.
Through the e-health data system, are they?
I think no. We're looking to provide it in many different ways. In many ways, in certain instances, we've been asked. In the case of Michigan, we've been asked who the governor of Michigan would like to. I think she's become a big fan of it as a medication, as something that's going to help with this horrible virus. And we're delivering it to the governments of various states when they ask. So certain states are asking, certain governments are asking, and we're delivering it directly to the government. Yeah, please, go ahead.
Thank you very much, Mr. President. We know many people around the world are paying close attention to this press conference. So on behalf of
Where are you from?
Media,
where are you from?
I'm from Taiwan.
Good.
Yes. On behalf of Foreign Media Group, I'd like to ask you 2 questions. First question is that the French President Macron called Iranian President Rouhani and said that Europe has started to ship the medical goods to Iran. Will you consider
medical goods?
Yes.
That doesn't bother me.
Yeah. So will you think
if they're sending medical goods to Iran, it doesn't bother me. No.
Okay.
Okay.
Yeah. So the other question is that the world also paying attention to the U.S. election. So we are also we know that Bernie Sanders has dropped out today.
I did see that today.
Yeah.
Well, he didn't really drop out. He didn't really. What about his delegates? I mean, he said he's going to keep his delegates, and which is sort of interesting. He's going to keep his delegates, and he'd like to get more. Now, is he dropping out or not? That's not dropping out. When you keep your delegates and then you want more delegates before you get to the convention, that's a weird deal going on there. I don't know what's happening. And I don't know why President Obama hasn't supported Joe Biden a long time ago. There's something he feels is wrong. Why isn't he'll come out? I'm sure he's got to come out at some point, because he certainly doesn't want to see me for 4 more years. We're not. We think a little bit differently. You know what? I'll tell you. It does amaze me that President Obama hasn't supported Sleepy Joe. It just hasn't happened. When's it going to happen? When is it going to happen? Why isn't it? He knows something that you don't know, that I think I know, but you don't know. So it'll be interesting. But with Bernie, I saw his standard fare today. I watched. And I hope that a lot of Bernie Sanders people, just like they did last time, we got a tremendous percentage of Bernie people And I think they voted for me largely because of trade, because Bernie and I agree on trade. We agree that the United States has been ripped off by virtually every country they do business with. The difference is I've done a lot about it, and I'm doing more about it. And we've made incredible trade deals, including USMCA, the deal with China, and then all of a sudden that gets disturbed by this virus situation. But